Hi friends, I am Dr. Vishal Gupta and I am a consultant pulmonologist at the Chest Care Clinic Kharghar in Navi Mumbai. We will be discussing about air pollution and its impact on the lungs. Air pollution is an invisible threat, and this threat is especially important in those who are living in big cities. With a lot of vehicle pollution, with industrial gases, particles, as well as the changing environment and the climate, will all lead to a large amount of particulate matter, or let's say PMs, what we call it in our language. This will lead to a lot of respiratory problems. It is already causing a lot of breathing problems in our lung disease patients, and they also cause lung diseases on their own. These can in the long term cause lung cancer as well. So what can we do to protect ourselves from this lung damage? Air pollution is a mix of harmful particles and gases from various sources, including vehicle emissions, particulate matter, burning of the fossil fuels. The particulate matter especially is very important for the lung damage that we see in our Navi Mumbai area. Particulate matter is basically of two types. It is PM 2.5, which is ultra fine particles, and the PM 10, which is the fine particles. Of these, the PM 10 is one of the important causes of respiratory problems to our asthma, COPD, and bronchitis patients. PM 2.5 is supposed to be linked to increasing risks of lung cancer. The long-term exposure to the polluted air will lead to chronic conditions like asthma, and these will be eventually becoming difficult to treat. So it is important for our asthma patients to recognize the problems that can happen with air pollution, and to note that this can happen in specific seasons, especially between the last week of November up to the first week of March, because the air is colder around us, the movement of the air is less, and also there is no rainfall to wash away the pollutants which are generated during this period. The closed areas, that is the areas where chemical exposure is happening, or inside a car where there is cigarette smoking happening, can be exorbitantly high. So the air around us is defined as outdoor air and indoor air, and usually the homes that we have that are exposed to wooden chulas or kerosene gases, where there is a lot of particulate pollution in the closed environment, they are very high risks for our homemakers and for the people working in the hospitality industry, in restaurants, where they can be exposed to large amount of such fumes and create a lot of lung disease that is seen in the patients as well as in the future. The vulnerable groups are mainly the children and the elderly who exhibit early symptoms. That means even with low levels of pollution, they will have a large number of respiratory problems. Then comes the sensitive group, that is those patients who have got asthma and COPD or other lung conditions, including lung cancer, where they will have more frequent bouts of cough, cold, and breathing difficulties, and will require more medications than usually given in their disease. Thank you for watching. Stay informed, stay safe, and breathe easy. I am Dr. Vishal Gupta. For more information regarding our healthcare services, please feel free to contact us on the link given in the description box. For your comments, please leave them in the comment section. Like, share, and subscribe this video. For more such videos, please give us a heads up and a thumbs up.